Hello everyone, my name is Dr. Aubrey Tager. I am a doctor of natural medicine. I'm a naturopath and I practice in the town of Pointe-Claire, which is a suburb of Montreal in Quebec, Canada. Now, what I'm going to be talking about today is something that is very near and dear to a lot of people's hearts and something that is very difficult to deal with when you're a parent. And that's dealing with things like ADD, ADHD, and the autism spectrum, and those challenges that go along with it. And challenge is a very appropriate word because that's exactly what it is on a constant basis. It's a challenge. Now, in the next several minutes, I'm going to be going over some important information that you can use both at home and in school environments. When a child is suffering, it's not just the child that's going through this. It's the entire family, the parents, the siblings, friends, other family members. Everybody is suffering when this child is not able to deal with the issues that they're presented with. Now we're going to look at some facts about ADD. But first and foremost, I want to say that I really don't like these labels, whether it's ADD, ADHD, autism spectrum. These are really there so that people can understand and relate to what their child may have. But they're really a misnomer because not every child is the same. Every two kids are going to be totally different. The brain is not the same for everybody. The brain is different. Everybody's brain reacts differently. So there is no set standard for all of this across the board. We have to look at, ideally, what functionally is not going on with the child or an adult, it doesn't have to be just a child, and how we can go about correcting that. Now, some ADD facts, it is the most common learning and behavioral disorder in children. It affects 6% of the population. And when we're talking about these numbers are for the United States. We don't have as much data in Canada, but it's a lot. So basically that's 1 out of every 15 children in the United States is affected with this. Now many more go undiagnosed because they don't have what's called the hyperactive form. So they might be on the spectrum, but for whatever reason, the testing shows that they don't have everything that fits into the ADD model. That doesn't mean there's not an issue, it just means that they don't fit into this category. So children that suffer from this, and I'm saying children as opposed to adults, so when it starts in childhood, they have a 35% chance of never finishing high school. 52% could end up abusing drugs or alcohol, and 19% smoke cigarettes compared to 10% of the general population. Now, 43% of boys will be arrested before the age of 16 for a felony, and parents of ADD children divorce 3 times more often than the general population. This can be a very strong burden on a child that's already got a lot of issues to start to feel that they're responsible for their children splitting up. That's not to say that they are, because obviously they are not, but that is the feeling that they might get and part of the burden that they might end up with when they're going through this. So kids need help. They don't need a massive diagnosis. That's not to say that you shouldn't have your child diagnosed. And the reason why I say this, especially in places like the province of Quebec, where in order to get help from the schools and from the school boards, you want to make sure that you have that diagnosis from a psychologist, because that's going to allow you to be able to put in the tools into place in the school environment so that the child can get the help that they need in school. That doesn't mean it's correcting the problem. It means that we're working in tandem with the teachers, we're working in tandem with their pediatrician, and we're working in tandem with their psychologist if there is neurocognitive behavior that needs to be done. We all want to make sure we're working as a team in order to help the child get better. Now, children, on the other hand, do not need these diagnoses for dealing with the condition itself. Like I said, it's for the school so that we can get a rounded approach. But in order to address the specific issues in the brain, we don't need to do that. We don't want to put a label on them and say, here, this child has this, and we're just going to go and follow basic ADD protocol. Now, is autism and ADD an epidemic? Well, the American Academy of Pediatrics reports that 1 in 91 children have autism, not including ADD and ADHD. And 1 in 38 are boys. Okay? 10 years ago, this was 1 in 10,000. So do the math. Is it increasing? Is it decreasing? Is it staying the same? This is becoming an issue. The Mind Institute published data stating that since 1990, there has been a 700% increase in cases of autism. This is not 10%. 10% would be astonishing. 20%, 30%. We're talking about a 700% increase. That's a lot. Only 127% of this could be attributed to improved diagnosis. So there's something else going on there. Well, research. Let's look at the research. Research clearly demonstrates a significant rise in the number of new cases of ADD and autism being diagnosed. The rise in incidence has increased so fast for this to be primarily a genetic factor, which means it has to be environmental as well. There are genetic predispositions. People are going to have genes for all different kinds of diseases and different kinds of problems. But there is what's called epigenetics. And just because you are genetically predisposed to a condition, that doesn't mean that you're going to express that gene and have that problem. But epigenetics means that what's happening in your environment, that is going to contribute to whether or not this gene is expressed. So what causes it? So we just talked a little bit about epigenetics. Can it be things in the environment like toxins? Can it be due to vaccinations? There's been a lot of talk about vaccinations in the news. We've seen all kinds of different celebrities going for and against vaccinations. Vaccinations themselves are not the cause of this, but they may be a contributing factor in epigenetics. We cannot overlook that as being a contributing factor. Not the cause, but a contributing factor. Medications. Can side effects from medications and the reaction that a child's brain has to those medications, can that be a contributing factor as well? Poor maternal health. Does the mother's predisposition, does her health contribute to the way that the child is expressing themselves and having an issue in the future? And what about autoimmunity? Is the body not able to get rid of problems that would normally be able to get rid of? Is it now attacking its own cells in an autoimmune fashion? So I'll tell you right off, it's not just the genes. Genes alone do not tell the whole story. So let's read this here. Recent increases in chronic diseases like diabetes, childhood asthma, obesity, or autism cannot be due to major shifts in human gene pool, as those changes take much more time to occur. They must be due to changes in the environment, including diet and physical exercise or activity, which may produce disease in genetically predisposed persons. And that's what we just talked about, the genetic predisposition. This is from Dr. Francis Collins, MD, PhD, Director of the National Institute of Health, and the architect of the Human Genome Project. So as we said, epigenetics play a role. Gene expressions can be turned off by a process called, or turned on and off by a process called methylation. Okay? If a parent has a methylated gene which turns off the expression of that gene, it can be passed to the child in the turned off position. This gene has not been expressed. This is genetic predisposition. Now, epigenetics is going to determine whether or not that gene gets expressed. If that gene plays a role in brain development, you can see how this may impair brain development in the child. Now, how do you identify this risk? Well, look at the parents. We first and foremost have to start looking at the parents. If you see autistic or ADHD tendencies, an autistic phenotype, there may be an increased epigenetic risk. Now, deficits in social skills, antisocial behavior, and inability to read body language, tics, awkward gait, meaning the actual walk, gait is walking, head tilt, or clumsiness. If you find that your child is extremely clumsy. Now, do toxins cause ADHD? Well, we live in a toxic world. While we're in the womb, the mother actually needs to reduce toxic exposure. Because if the mother's exposed to all these toxins, that's going to get relayed to the child. And after birth, we have to limit the exposure as well. So there is evidence that having increased exposure in early development increases risk factors for autism spectrum disorders. Toxins that should be avoided. So let's take a look at some of these here. Heavy metals. So things like mercury, aluminum, lead, and cadmium. This is not to say that metals aren't important. Some metals are very important for our body. But when we have a toxic amount or a certain part of your body, everybody's body is different, reacts to these problems, that's when we could end up having what's called heavy metal toxicity or a reaction to those metals. Electric pollution power plants, power lines, Wi-Fi, TVs, microwaves. All of these things give off different electromagnetic fields. Is one by itself, is standing in front of a microwave going to cause a problem? No. But the cumulative effect and the amount of exposure, now when somebody has an immune system that is being impaired and now you go and expose them to all of these different factors, that's when these become contributing factors and can start to snowball the effect. So road pollution. Research at the University of Southern California showed that children born to mothers that lived within 1,000 meters of a busy road doubled the risk of having a child with autism. So if you're exposed to something that's going to double your risk of anything, if somebody told you right now, go and eat that and you're going to have twice as much chance of walking outside and getting hit by a truck, are you going to do that? Well, nobody wants to double their risk of having a problem. So why not minimize the amount of risk that you have so that you don't have to deal with these issues? Once again, we're not saying all these issues by themselves are causing these problems, but they're contributing factors, and the more we're exposed to them in quantities, the more problems we may be experiencing. Pesticides and insecticides. Use more organic foods and go green in regards to yard chemicals. So if you're doing your yard at home, try not to get some of these big companies that come and put toxins so you have a nice green lawn. Is it more important to have a green lawn or to have a child that wants to play on the grass and not have toxic problems? Vaccinations must be the cause, right? We hear that all the time. Vaccinations are causing autism. Vaccinations are not causing autism. It's bunk. It's true. We don't know. Here's what we do know. In 1991, we doubled vaccinations in the United States. Since then, there has been a 7,000% increase in autism. That's not a typo. That's 7,000% increase. 400% increase in ADHD, a 400% increase in ADD, and a 400% increase in allergies. So can vaccinations be a contributing factor? Yes, it is a possibility. It is something to look at. So what we do have here is we have an autism epidemic from 1992. This is going up to 2005. We're not even up to 2010 or 2016 yet, but we can see that rise. It's a huge rise. It's a massive shift. Excuse me. Two interesting studies regarding vaccinations. So in Chicago, Home First Medical Services reports 35,000 children who received no vaccinations, and in that group itself, they did not have one case of autism. Something to think about. Another thing to think about, the Amish community itself. Children have never had vaccinations, and they have no reported cases of ADD, autism, or allergies. Amazing. Here are some medications associated with increased risks. Thalidomide. We know this. We know about babies that were born due to mothers using thalidomide and their appearance with the small limbs and the neurological problems that go along with that. So it has been used to treat morning sickness. It's not used anymore, we hope, but is currently being used for treatment of Crohn's and multiple myeloma. One of the issues we have with some medications is that they do work. The problem is that they work so well, they want to go and use them for other things. And what I mean by work is killing things off. If they can help to kill things off, why not use them somewhere else? The problem is the side effects that go along with that. Misoprostol used to prevent gastric ulcers, valproic acid used for seizures, bipolar disease, and migraines. And number 4, antidepressants, SSRIs show a moderate increased risk as well. These are the most widely prescribed of all antidepressants. Maternal role may have a role as well, or maternal health may have a role as well. Levels of stress for the parents, for the mother specifically, work, marriage, these are associated with increased risk. The mother has to be healthy as well. Mentally, physically, emotionally, she's got to make sure that she's able to deal with the effects of going through all of these hormonal changes when the child is being born. Obesity increases risks, gestational diabetes, preeclampsia, and does the mother smoke or drink during pregnancy? Autoimmunity itself is going to increase the risk as well. Maternal antibodies, called IgG, have been known to cross the placenta to the fetus to offer immune protection for the first 6 months of life. We know that many other antibodies are present in the mother can also cross the placenta if the mother has an overactive immune system. And this can cause or create an inflammatory process. And this happens to get passed on to the child as well. Johns Hopkins University concluded that if the mother had one of these disorders present, the risk of autism increased threefold. So if you have a child who is autistic, you want to see, okay, first of all, was there type 1 diabetes? Was there celiac disease? Rheumatoid arthritis? These are autoimmune conditions. Deficiency of motor stimulation. Postural and primitive reflex stimulation is vital to normal brain development. As we're developing our brains as babies, we have certain reflexes. They're supposed to be there. We have to make sure that those are remediated at certain times, and we're going to get into that. So allowing a child to roll on the ground, to reach for objects, to struggle with movement is essential for the developing brain and the postural back muscles and reflexes. Babies spending too much time with walkers or baby bouncers bypass this normal development. And the reflexes can cause poor frontal lobe development. The frontal lobe is what we deal with when we're looking at executive decision. We're going to talk about that a little bit later on. Sensory feedback. So gravity and pressure, this also helps to develop the brain. So ADD, ADHD, and autism rarely have a single cause, as we can see. There are multiple causes. It is more commonly due to a perfect storm of events, a cascade, a multitude of different events that changes the brain development. So let's look at some medications. So some medications that are being prescribed, and your child may be on some of these, include Ritalin, Concerta, Adderall, Focalin, Dexedrine, Vyvanse, Disoxin, and Metadate. How does medication actually treat ADD? Well, the facts regarding certain things like Concerta or Ritalin. Concerta and Ritalin are considered central stimulants. So the mechanism of action is believed to be that they increase dopamine release in the brain. And dopamine is associated with that frontal cortex that we're going to be talking about. One theory of ADD is that there is a deficiency of dopamine in the prefrontal cortex and the basal ganglia. Now, this doesn't mean that the body can't redevelop that. What we're doing with these medications is we're putting synthetic kinds of dopamine or precursors to dopamine into the body in order to release more dopamine. So how effective is this treatment? Well, an MTA study, 1999 versus 2007. 1999, the multimodal treatment of children with ADHD was the first long-term one-year study that showed these medications were helpful in kids with ADD and ADHD. In 2007, they did a follow-up study, 3 years with the exact same research team. What did they learn from this long-term study? Well, it showed that after 36 months of treatment with central stimulants, there were no positive effects, contrary to what the actual team expected. So it also showed that these stimulants showed a decrease in the child's growth, decreased brain growth. It also increased aggression and antisocial behavior. So some central stimulants are going to increase the risk of drug abuse. It doesn't mean that no children need medications. Some children do need medications. I want to make sure that that is clear. I'm not here saying nobody needs medications. It's a matter of there are medications that are being overprescribed, and there are other options that are available in order to achieve the goals that you want without having to utilize medications, if that is what your belief is. In 1998, Professor Nadine Lambert of the University of California, Berkeley performed a longitudinal study on children with ADHD, half of whom were prescribed central stimulants and half of whom were not. Use of central stimulants for more than 1 year was significantly and pervasively implicated in the uptake of regular smoking, in daily smoking in adulthood, in cocaine dependence, and in a lifetime of cocaine and stimulants. So a dependence on medication can lead to dependence on other types of drugs or narcotics. Your brain habituates to all stimuli, so it's going to change and it's going to need different types of stimulation. So the types of ADD and ADHD. The goal is not to give a child a label like we said earlier on. Our goal is to identify the problem in the brain and to rehabilitate that part of the brain that's being affected. So is autism or ADD exclusively a right brain disorder? Well, autism generally is a right brain disorder. Dyslexia is a left brain disorder. But we're going to see some crossing over here, and it's not 100% right or left, but that is the primary dominance. There is evidence that it's the ADD and ADHD specifically is a mixed bag. It goes back and forth. Deficits in either the left or right prefrontal cortex, temporal lobes, or basal ganglia can manifest the symptoms associated with ADD or ADHD. So we'll just take a look at some of the different things that are associated with the left brain and the right brain. And you can just read those there. I'm not going to read all those back to you. So regions of the prefrontal cortex. Your prefrontal cortex, what we have is it's divided into different areas when we look at the anatomy. The dorsal lateral cortex, so the back outside part of the frontal part of the brain, is involved with sustaining attention span and keeping us on task. So this is what allows us to sit still in a classroom or in an office environment and not want to get up, walk around, and do something else. It allows you to feel and express higher emotions such as happiness, love, joy, or sadness. It also deals with short-term memory. So now we look at what's called the ventrolateral cortex. This is the front part of the frontal cortex to the outside. So the ventrolateral cortex helps you think about what you need to say before you do it. I think about what I'm going to say before I'm saying it right here on the video. I have notes, I have plans. I don't just go and blurt things out that are inappropriate. Okay? This, if you see a child or an adult that just blurts things out and it feels like they have no filter, this is the ventrolateral cortex. So it allows you to select alternatives in social situations. If you inhibit an activity, this area lights up. Most of what the brain's function is to inhibit other parts of the brain. Okay? This powerfully exercised with what we call anti-saccades. These are eye movements. Okay? Moving your eyes back and forth, that's going to stimulate different parts of the brain. The medial or inside part of the ventral cortex, this is a source of self-motivation. You see a lot of children that they lose that self-motivation. So self-motivation, it allows you to learn from your mistakes. so that you don't keep doing the same things over and over again. It allows you to apply your moral values to your own behavioral patterns. Now, the anterior cingulate gyrus. This is located also in the frontal lobe of the brain, and it serves as a connection and part of the limbic system. Our limbic system is our emotional system. This is where we feel emotions. This is where we're going to get instant gratification. This is where we're going to feel sad as well. So it functions as a gear shift for your brain. Okay? An overfiring of this area, of this anterior cingulate gyrus, causes you to get stuck. So things like OCD, those types of symptoms where you're focused on and you can't get out of a certain thought process. The dorsolateral prefrontal cortex inhibits the anterior cingulate gyrus. Okay? So once again, we're seeing that inhibition of or blocking out of other things by the brain, if the brain is functioning properly. The basal ganglia. So the basal ganglia, it deals with movements. Okay? So if you happen to have a movement where you're moving too quickly or too slowly, these are different pathways of what we call the basal ganglia. There's a direct and an indirect pathway. Okay, a couple of keys to understand. In this, there's going to be a release of dopamine. Okay, dopamine excites the direct pathway. Okay, excitation of the direct pathway excites movement. So dopamine, what it's going to do is it's going to inhibit the indirect pathway. This also stimulates movement. This is where knowing neurology becomes very important because the brain is very complex. So it's not just a matter of taking one thing in order to achieve your goal. It's not just going out there and taking a supplement. It's knowing specifically for the child or the adult which part of the brain is not functioning, which pathway is not functioning, and how can we get that stimulated properly. So too little dopamine is going to have an increased inhibition of the thalamo-cortical projections, so those get decreased, and frontal lobe stimulation, we're going to have escape of the thalamus, and then what we have what's called hyperkinesia, so an increased amount of movements. Big words, a little bit difficult, but this is why the neurology really comes into this. So the most important thing to take away from this is you want to know that the neurology is complicated and that ADHD is not simply just a right brain weakness. We've really got to look at what's going on functionally. We're not talking about neurology with regards to tumors or cancers. We want to rule all of those out. And when those are not present, there are different areas of the brain that are not functioning properly. How can we get them functioning properly again? There needs to be a harmonious level of activity occurring in the different lobes and in part of the lower part of the brain called the cerebellum, the basal ganglia, and the limbic system. The good news is that these areas are all working well together. If you find one of them that is out of sync, we want to work to be able to improve it and have a good chance at being successful. But we've got to look at all of these different areas. Now let's look at the different types of ADD or ADHD. So type 1, traditionally, is what we call classic ADD. So some of the characteristics that we see are hyperactivity, restlessness, impulsivity, and the child is distracted. So this is your typical ADD child in a classroom. They're looking around, they get easily distracted, they don't want to sit there, they want to get up and move around a little bit. As babies, they tend to be colicky. We don't try not to use the word colic anymore. It's not really a big thing, but traditionally colicky, and they're difficult to soothe. They have less than average eye contact because they're not able to focus. That part of the brain is not keeping that focus. So let's look at the neurology behind this. It tends to be a right hemisphere, right brain problem, and that right brain is the brake pedal of the body. When we look at this, we see the orbital frontal prefrontal cortex, thinking about what you say before you say it, mood controls, and social skills. So your child coming up and hanging all over you, licking the back of your head, kissing your ear. Are they 10 years old and doing that? It's a little bit inappropriate for society. So are there different parameters that are going on? Are there things going on in society where it is not appropriate? The dorsolateral prefrontal is very involved in sustaining attention span and expressing thoughts and emotions. The basal ganglia is underactive, so stress will drive the individual into action. So what we see with ADD is this is a classic case, generally, of a dopamine deficiency. Okay? In general terms, we don't just take this and say everybody has got this problem and we're just going to throw dopamine at it. If there are no other complicating factors and there is nothing else and it's strictly what we just talked about, then it would be a dopamine deficiency. The basal ganglia is underactive and therefore does not release enough dopamine to stimulate the prefrontal cortex. So by adding dopamine or things to release dopamine, we're not talking about synthetic dopamine or drugs. Dopamine is a natural substance and is actually available in supplemental form. We can do that as well. So inattentive ADD. So what are the characteristics? This is the most commonly underdiagnosed form of ADD. It's as common in girls as it is in boys. You still get easily distracted, but they tend to be very quiet. They're kind of like daydreamers. They're couch potatoes. They don't really want to get up and move around. They're just kind of lying there. So the neurology behind it. The prefrontal cortex underfires, especially when trying to concentrate. The basal ganglia in this instance is normal, and the chemistry, dopamine, is also deficient. Then we have what's called over-focused ADD. This is the third most common type of ADD. We still have the core ADD symptoms like inattentiveness, but it's accompanied with a tendency to get stuck or locked on certain behaviors or thoughts. Okay? So it tends to be found in substance abusers and children or grandchildren of substance abusers and alcoholics. That doesn't mean you have to be an alcoholic to have this, but the studies show that this does happen very often with them. So if all of a sudden you come in and we see your kid's overactive ADD or overfocused ADD, that doesn't mean we're saying that you're a drug addict or an alcoholic. We're just saying that the numbers in general have shown that. So the characteristics, we have an increased firing of the anterior cingulate gyrus. Once again, as we talked about, it's the brain's gear shift, and overactivity leads you to get stuck on thoughts and behaviors. This is comparable kind of to OCD, as you might have heard that term in the past, obsessive compulsive disorder. The child or the adult can worry excessively. Okay? They have compulsive behaviors, they hold grudges, they have difficulty seeing options in situations. So they're like this, they're set on go, and you wind them up and set them forward. They're not seeing the big picture. They're not able to look around and see what other kinds of options are out there. They have trouble shifting their attention. They also, because of this, they become oppositional and extremely argumentative. Okay? Now with overfocus ADD, the neurology of it is the anterior cingulate gyrus is overfiring, it's overactive. It's important to differentiate this form of ADD from OCD. Okay? In overfocus ADD, they will be stuck on behaviors, but they will also have some core ADD symptoms. So inattentive, impulsive as well. The chemistry behind this is the anterior cingulate gyrus is heavily loaded with serotonin receptors, the receptors for serotonin. So serotonin support, utilizing serotonin, may be beneficial with this type of overfocus ADD. Okay. So temporal lobe ADD, the characteristics of that are we have associated with severe behavioral problems, periods of quick temper or rages. They misinterpret comments as negative. So these are the children that you're telling them something and everything they're taking as a criticism, whether it's good or bad, everything to them is negative. They get periods of spaciness or confusion. They have very dark thoughts. This can even get to the point where they become suicidal or homicidal. The neurology behind this, the left temporal lobes, we see symptoms associated with direct discomfort, anger, irritability, aggressiveness. You will also see some language issues there. Right temporal lobe, problems are associated with internally directed discomfort, anxiety, fearfulness, difficulty reading facial expressions. They might have problems looking at somebody and seeing, is it an awkward situation? Is somebody not laughing when they're telling a joke? They're not able to read that off of a person's face. Or understanding the intonations, the actual enunciation of somebody in their voice, and the tones of their voice. Other symptoms of temporal lobe dysfunction: abnormal perceptions, memory problems, feelings of deja vu. They might have periods of panic or fear for no reason whatsoever, some spaciness or confusion. Sometimes they get a preoccupation with religious or moral issues, and they might have unexplained headaches or stomach aches. Some examples of common illusions. So when I'm talking about illusions earlier on, so seeing objects change in size or shape. They might actually see this, or they might see like paintings moving, seeing shadows or bugs out of the corner of their eye, hearing buzzing. So if you hear a buzzing, it doesn't mean you have this problem. There's a little buzzing going on right now with my video. But if you're hearing buzzing or static from the radio when there's nothing going on there, where it's a quiet environment, smelling odors or getting odd tastes in the mouth, like weird just taste for absolutely no reason, or feeling bugs crawling all over their skin. Okay, these are common illusions associated with this. Temporal lobe ADD. So GABA support is an effective neurotransmitter which helps to support the negative emotions. The temporal lobe is also rich in acetylcholine receptors. So acetylcholine support along with GABA, which is gamma aminobutyric acid, that can be beneficial. The other thing is phosphatidylserine, which we see in some products, specifically one called Adrenacom. So dyslexia versus temporal lobe ADD. Dyslexia, you have difficulty with reading and writing. Okay? This is also associated with temporal lobe dysfunction, specifically on the left side. It's really, when we're talking about this, it's a matter of semantics. Which one is it? If you see a child that suffers more difficulty with reading, spelling, writing, you would suspect dyslexia. If the child is more socially impacted, inattentive, and emotionally distraught, you would suspect temporal lobe ADD. So limbic ADD. You have core symptoms of ADD plus inattentiveness, impulsiveness, plus you have negativity, moodiness, sadness, low energy, and decreased interest in life itself. So this is the limbic part of the brain. The emotional part, or expression. So an underactive prefrontal cortex, both at rest, excuse me, and during episodes of concentration, increased activity of the deep limbic system, increased limbic activity, and decreased limbic activity, more positive, hopeful states of mind. So this is the neurology behind it. The front half of what we call our hypothalamus is going to send calming signals throughout the part of our body called our parasympathetics. We have sympathetics, which are what we know as fight or flight, and parasympathetics. This is the part of our body that deals with rest and digestion. Okay? The back half of the hypothalamus sends fight or flight signals through the sympathetics, and it works with the prefrontal cortex to serve as a switching station between rational and emotional information. So some key neurological tests. When somebody comes in here, I'm not coming in to do a diagnosis, okay? What I'm trying to do is I'm trying to locate the area of the brain that's being affected so that we can come up with a specific plan to target that area. The only way to be able to determine which therapies are going to work best on a child or an adult is to be able to go through and evaluate that neurologically so we can see what part of the brain is being affected. So we can do things like pursuits, saccades. These are all eye exercises or eye tests, better to say, anti-saccades. Smell. We can do things like other eye exams, balance, primitive reflexes. We might send you out in concert with your pediatrician to look for an EEG or an EMG to make sure there are no other issues there. So what are we looking for with each one of these tests? How does it relate to an ADD symptoms? How do you explain this all to the parents? Well, that's what we're trying to do. We're trying to take all of this together and put it all together so it's understandable. Reflexes, the Moro reflex. This is fully present at birth. It's inhibited in the first 2 to 4 months of life. Okay, this is the startle response. If it persists into adulthood, it's going to lead to hypersensitivity to certain stimuli. Okay, this reflex will have more of an overall emotional effect on the child than any other persistent reflex. So long-term effects if this reflex doesn't get remediated: motion sickness, poor balance, poor coordination, poor pupillary reaction to light, continuous anxiety, vestibular related problems, so problems with balance and coordination and falling, mood swings, tense muscle tone, auditory processing, so filtering out of sounds, weak ego, low self-esteem, visual perception issues, and those are just some of them. The next thing we have is what's called the Palmar reflex. So the Palmar reflex is fully present at birth. It's inhibited in the first 2 to 3 months of life. It allows for dexterity as hands to develop. So if you go and stroke a baby's hand, they're going to grab onto your finger. That's the Palmar reflex. It's a linking with the sucking movements of infants. And the long-term effects, if this is not remediated within the first 2 to 3 months of life, excuse me, is poor manual dexterity, poor pincer grip. This can affect the way a child actually holds a pencil or a pen in school. Speech difficulties, primarily affecting articulation, the way that they actually speak. The child makes movements with the mouth when they're trying to write or draw. So you might see things like this as they're trying to write or draw. Asymmetric tonic reflex, this is fully present at birth. It's inhibited at about 6 months. So we see an extension of the head and leg to the side that the head turns without or with flexion of occipital limbs. So if we're turning the head, we start to see movement of the limbs. This reflex helps to develop muscle tone and to provide vestibular stimulation. So stimulation to the balance network that we have in our brain. But once again, this has to be remediated or has to disappear at about 6 months of age. The asymmetric tonic reflex, long-term effects: balance affected with head movements, homolateral walking, difficulty crossing the midline, poor ocular pursuits, poor handwriting. So these are all issues that can be present if you have a child who is, let's say, now in grade school. They are in grade 1, grade 2, grade 3, and they're having difficulty with these types of issues. Those reflexes may be present. That's one of the first things we check when the child comes in is, are these reflexes present or have they been remediated? Or do they need to be remediated? The rooting reflex, the long-term effects of that. So rooting reflex, when they go and stroke a baby's face here and they turn, it's a rooting reflex so that the baby's mouth can actually turn to the mother's nipple and suckle on that. Long-term effects: balance affected with head movements, difficulty crossing the midline, once again, poor ocular pursuits, and poor handwriting as well. So hypersensitivity around the mouth and lips. You may see speech and articulation problems that may cause difficulty with the introduction of solid foods when the baby actually starts eating. Spinal gallant. So this is actively present at birth. It's inhibited 3 to 9 months of life. Thought to play a role in the birth process. Contractions stimulate the reflex, initiating rotation of the baby's torso into proper position. So as the baby's coming out, the baby's able to rotate. So what we do is we stroke down the baby's back or the child's back, and the spinal galant, you want to make sure that they're not moving in the unintended positions. So long-term effects: fidgeting, squirmy, prolonged bedwetting, poor concentration, poor short-term memory. And if this presents in adults, it can contribute to IBS, irritable bowel syndrome. So it's very important to make sure that these are all remediated, that these primitive reflexes are not present as the child is growing. Okay? So symmetrical tonic reflex, this is one of the other reflexes we look at. So here are some basic remediations. And remediations, generally what that means is, what are we going to try and do to fix that? Okay, so we might do this in the office, we might give you some of these to do at home if these are still present. Spinal galant remediations. So what are some of the therapies that we actually do in order to try and help with a child or an adult that is suffering from any of these issues? Some of the things we do in our office are neurofeedback. So neurofeedback is a brain-based form of biofeedback, which is actually developed for the heart, and this utilizes brain waves. Now, there are many schools of thought with neurofeedback. Each has its own protocol. There is operant conditioning, a reward-based system of learning in which the organism must discriminate between stimuli in order to obtain reinforcement. What does that mean? If a child is watching a movie and they're not focusing, the movie will turn off. It will continue to play and reward the child in order to watch the movie as they are focusing more and more, and as that happens, the brain is retraining to be able to focus. So your brain actually exhibits different types of waves at different hertz, different levels. You have delta waves, which is at 1 to 4 hertz. This is the slowest waveform. This is associated with sleep and deep depression. So imagine if you have delta waves going on and you're walking around during the day and you have delta waves. You're walking around in a fog. You're fighting sleep just to stay awake. This happens a lot. Theta, 5 to 8 hertz. This is the gateway frequency that connects to conscious and unconscious state. Increases indicate attentional problems. Alpha waves seen during relaxed states, and beta waves, the fastest waveform, seen during concentration or thinking, but not too much, because that can lead to anxiety. NeuroTracker. Now, NeuroTracker, this is a specific product. It's by a company called Cognizant. It's based on years of scientific research and the works of Dr. Jocelyn Faubert, Director of Visual Psychophysics and Perception Laboratory at the University of Montreal. Dr. Faubert is recognized as the world expert in perceptual cognitive research and leads a multidisciplinary team of researchers and PhD students there. The scientists behind NeuroTracker are continually driving new discoveries into human motion perception, neurostimulation, training, and rehabilitation. So how does this work? Well, it's cognitive training for real-life situations. It's the only product of its kind on the market today which combines 3D, so three-dimensional multiple object tracking, so that you can actually see and track things in 3D, motion capture and skill specific, so this actually helps with the frontal cortex in focusing. So it uses the ability to use dual task for training, so you can actually have a child doing, not just sitting still and focusing on tracking these balls, but actually doing what they do, whether it's a sporting event like hockey or basketball, and still continually trying to improve that tracking or focus. So this is done in a game-like type of environment. Students enjoy this, children enjoy it. It's very rewarding. It's not a very difficult thing. It takes about 10-15 minutes. Lab testing. So very important. We want to look at food intolerance testing. Okay, is the body not responding to certain things? Is there leaky gut? Are they not getting the vitamins out of the foods that they're eating and absorbing them? Is that causing part of the problem? there is a metabolic process associated with this too. This is not just the brain, there is a link between the gut and the brain. So your gut is made up of your large intestine, your small intestine, your colon, your stomach. If that whole process is not functioning properly, then that correlation between the brain and the gut is going to be affected. So we want to do things like a metabolic panel. We might look at organics profile. Organics is going to show us if in fact we are getting the proper nutrients out of our actual food that we're taking in through what's called the Krebs cycle or a TCA cycle. Some brain-based treatments. So we might look at specific treatments for different areas of the brain. So we see a multitude of them here. Balance beams, small trampolines, swaddling, anti-saccades, visual pursuits, metronome therapy, neurofeedback, highlights, hemifield glasses, neurotracker, true focus, visualization, remediation. There's a multitude of different ones. These are just some of the therapies we might do based on the area of the brain that is not functioning properly. Supplements. We might introduce supplements, multivitamins, methylated vitamins. So the methylation process. If you want to know more about methylation, watch our video on methylation and how that works and why this might be important to your child. Neuroimmune stabilizer cream, which has glutathione, the #1 antioxidant in the body. Vitamin D, probiotics, because our microbiome is extremely important. We have trillions of different bacteria in there. We want to make sure we have the right ones. L-tyrosine, a 5-HTP, which is actually the precursor to serotonin. GABA or dopamine, we talked about these before. Some key foods to eliminate, okay? Before you even see your child, if you see that you have a child that's experiencing this, you want to eliminate things like gluten, dairy, and soy. The reason is because these are the most inflammatory to the brain, okay? So if you have a child who has problems with the brain, decreasing the inflammatory process is going to be extremely important. Also, sugar and corn. So if you can just eliminate those off the bat, you're going to be 100% ahead of everyone else. So if you want to make an evaluation, if you want me to be able to determine if there is something I can do to help you or help your child, give us a call, area code 514-426-6449. You can also send me an email directly to Dr. Tager at neurologics.ca. If you want to learn more, go to our website, www.neurologics.ca. I hope that you learned a little bit about ADD, ADHD, autism spectrum, and how we may be able to help you. Thanks a lot, and have a great day.